CEO of Coast Mental Health says the province is protecting mental health spending in the budget, but there are gaps in community-based care.
What many people don't realise is most people start in community, and whether they come into contact with hospital or police, they'll end up back in community. So it really is those vital community-based services that people need when they need them, such as counselling.
The mass shooting in Tumbler Ridge and last spring's Lapu-Lapu Day Festival tragedy are shining a spotlight on early intervention. BC's health minister says funding continues for youth.
With the recent very tragic events that have taken place in Tumbler Ridge and ensuring that rural communities, remote communities have access to these resources. That's why we'll continue to expand Foundry resources available for youth.
This mental health advocate says more people need support before they're in a crisis.
The only kind of net gain in mental health spending in the health budget was that $131 million for involuntary treatment and assertive community treatment teams.
Morris points out involuntary care is the most expensive kind of mental health treatment. But the province has faced pressure from some mayors over the slow pace of such care. Vancouver Mayor Ken Sims says in a statement, it's been almost a year and a half since Premier Eby announced mandatory care, and despite that fact, Vancouver has yet to see a single new mandatory care bed.
What's missing is really what's in the middle there, the community-based mental health care that keeps people from reaching crisis in the first place. There have been some good gains there, but particularly given the crisis we're all living through financially here, now is not the time to kind of lose some of those gains.
The province's budget also includes funding for counsellors in the K-12 school system. Meera, Bains, CBC News, Vancouver.